And while we're waiting, if you would, go ahead and throw where you're from, your community, your state into the chat, just so we have a sense of who we have on the call. That's always really helpful to look back at over time too. All right, well, we're a minute past the hour. So in order to make sure that we get to everyone's questions and get through all the information we have today, we'll go ahead and get started. Welcome to Office Hours. This month, we're focusing on kind of community, local area strategies. And I'm happy to welcome Marianne Downing from San Diego and the Drowning Prevention Coalition, or Foundation, sorry, of San Diego. And she's going to share with us today the work that they've been doing kind of at that local level, which we're really excited. So Marianne, I'll turn it over to you.
Okay, already? All right, let's see if I can share again so that you can see the show and tell slides that I put together. Okay, here goes. Oh, I think you can see it.
Perfect.
Okay, well, thanks everybody. And Tina, thank you so much for this invitation. We're really honored to be able to present on a national level. So thank you very much. And so I want to introduce the Prevent Drowning Foundation of San Diego. Oh, I'm clicking. Hold on. There we go. So we have several board members on the call with us. Sandy Bruce is she's the magic behind the Prevent Drowning Foundation of San Diego. So the beautiful graphics and such that you see, she's absolutely amazing. Anna Gonzalez will be joining, and Bob Feinberg as well, and other friends from San Diego. Okay. Technical difficulties. So Tina, thank you for sending me a list of questions. The prompts were great. It made me do my homework actually and go to the website and find out, like, what are you talking about, like dissemination process? So let me just do a little show and tell about our organization and how we're plugging in with the National Water Safety Action Plan. So you asked the question, how did you get started and why? And that was not really tell me the history of your foundation, but the San Diego Junior Lifeguard Foundation is sort of how our organization was born back in 2009. We pivoted over to really focusing on drowning prevention, in addition to funding junior lifeguard scholarships in 2017. And so we have a great mission statement, and that's really to engage the community in a continuum of water safety programs that provide access to the life-saving skill of swimming. So it's across the board, not just the Junior Lifeguard Foundation. So back to the question, how did you get started and why? So in 2023, I guess, well, we're dressed with jackets and coats and snow boots, so we must have been in Colorado at the Broadmoor. I think it was the very last session of the few days. It was about the U.S. National Water Safety Action Plan, and you included in there a segment about the California Water Safety Strategy. And so these are the people that attended, and so that's really how it started, with getting San Diego on board with the U.S. National Water Safety Action Plan, as well as the California Strategy. So you asked the question, well, where are you in the process? Or in the dissemination process? And I wanted to just again talk about the turning point, that really what really helped our organization move in the direction that we're going into now. And that was that we became hosts of the California Water Safety Summit, and the California Water Safety Strategy was introduced at that event in 2023. But not only did it make a difference in California, but for our organization in our local area, it was a game changer for us. We brought in city officials, the chiefs and captains of lifeguard, fire and rescue, and it really, I think, put the Prevent Drowning Foundation of San Diego in a different light. We were really looked at as leaders when they saw us bringing in, international um, experts and leaders. So that just reinforced our work and drowning prevention awareness in San Diego. But that was really such an important time. So I would encourage everybody across the country to go to your statewide summits or conferences, and also go to the National Water Safety Conference. This year it will be back in Colorado Springs at the Broadmoor in February. Bring your snow boots. It might be amazing if you're from Florida, but get connected in. So here's where the homework started, Tina. So thank you. Go to the website, go get find out what you're talking about. To walk through the reflection steps, and again, we started out in 2009, so our organization has been around for a long time. But to really step back and say, okay, let's get this all organized and let's think about this in these buckets. And so that's really what we did based on this reflection slide. So you asked, how do we get people to the table? Well, we actually sort of had a party. After the Water Safety Conference in 2023, we came back to San Diego and we actually had a party with cake and water safety action plans from around the world. You can see them sitting on the table there. But we invited people to the table to debrief about what we learned from the national event. And we already had our partners and collaborators, but that sort of was a time when we're part of something bigger. So let's move forward and stay connected. So here are some of our collaborators, and I tried to put the mayor of San Diego in a life jacket in almost every picture. He's amazing, and he's one of our water safety champions. And I don't know if he shows up at our events or we show up at his events, but he's just been a great champion for water safety and drowning prevention. He's happy to put on a life jacket with a little sticker that says Prevent Drowning Foundation of San Diego. But our partners that do the most work is really the San Diego Parks and Recreation Department, their aquatics program, and the YMCA. They do all of our swim lessons. And I say I'm talking about the foundation and really our partners and collaborators. So here you can see some of our partners, and especially calling out the also fire and rescue, city officials, schools, nonprofits, as well as the Y and the Parks and Rec Department. The next question on the little grid, the reflection grid, is, well, what are your risks? What's your waterscape and hazards look like? And thanks to our board member, John Sandmeyer, who is the Marine Safety Captain in charge of tsunamis, as a matter of fact, he's provided this information to us. And we've done some community kind of outreach, and we show all of the areas where San Diego really could be impacted in terms of aquatic risk. And I should have put them in alphabetical order: the backyard bathtub, bays, lakes, oceans, rivers. We have floods, tsunamis, all kinds of things to worry about. But as part of the reflection, we also have to, take a look at the data. So that's really the next step. And we've been gathering data since 2023. Well, actually before that time, but during the Water Safety Summit in San Diego, the California Department of Public Health really made the point that it's really important not to just talk about fatalities in terms of drownings, but collect the information about emergency room and hospitalization. And that's what you see on this slide. And ages 1 to 4, you can see that it's off the charts almost. When you add all of the care, all of the incidents together that required care, and the fatalities. Most of the fatalities are at the upper ages, and 70% of those are men. But this is, I think, a good representation of where we can get started to talk about the conversation. In terms of drowning data, we also, well, I know it's a little big, sorry, it's large font. In terms of where San Diego residents are drowning, natural water has the highest number, so that could be the bay, the river, rivers, as well as the ocean. But bathtubs come in second. Bathtubs 69 in over an 8-year period in terms of fatalities, and then the pool was 55 fatalities. But anyhow, so we've gathered this information, so we have some kind of story to tell and some place to go from here. And so the next question on the slot, the grid of reflection is, well, what are your current efforts? And I know this is jam-packed. Don't even read it, but just say, wow, they're doing a lot over there in San Diego. We have funded in 67 in the past couple years, plus 28 grants this year, and that's our major focus is funding grants for swim lessons and water safety outreach. But we do presentations. We're in the community. We do lots of events, and you'll see some great pictures of that. So here's how we think we impact the community now. So now we got to the action step grid. And so this is where a couple board members and I, we looked at this like, okay, well, where are we? And we're sort of all over because we've already launched and implemented. And I know the cart's before the horse, but we didn't have this horse yet. So, so we keep moving on. But this really gives us a good place to really think about how we have to tighten up what we're doing and report on it. And so we're going to keep on going. So here's our continued action. The biggest thing that the Prevent Drowning Foundation of San Diego does is we have a grant program. Sandy's on the line, and she works so hard she coordinates the pool time, the nonprofits, the swim instructors, we do require pre and post swim session water competency surveys, which we haven't collaborated or compiled all of that data just yet, but we get that information coming in. So that's our biggest outreach program. This year, we received a grant from the County of San Diego to continue funding water safety and swim lessons. And this little poster over on the right side with these super cute kids in bright colors is our water competency, like the American Red Cross sequence. But we asked the kids, well, where do you think you are right now? Can you do this? Are you in the orange category? And then the goal is, of course, to move them up through the water competency sequence. So here's another action, and this is a great slide. It looks like fun. Everybody wants to come to San Diego, right, and jump off the pier. This has been going on for more than 30 years, and it's actually the fundraiser for the foundation, where you can see the kids in these are the junior lifeguards jumping off here, but it's a fundraiser in that it's open to the public, the parents, grandparents, the public. They're like, I want to jump off the pier, and so they give a donation to the foundation. And we hold this, it's twice a year. It's like the grand finale of the Junior Lifeguard Foundation's sessions. And it's really scary and high. And in terms of collaboration, we're now working with the Scripps Institution to have the kids jump off their pier. So it's a very big deal in our community, and it gets a lot of press. And there's our board member, John Sandmeyer, talking about water safety and drowning prevention and the fundraiser. So, and again, this is a junior lifeguard program, and the fundraiser is really to fund scholarships for kids that would not be able to afford to take part in this amazing program every year. It's just been an amazing program. Here's one of the former, down in the bottom, you can see we're hugging on Elijah. He's off to the Navy. He's been through the program, junior lifeguard, and now working as a pool lifeguard. And, you're just so proud when you see the kids back to the mission, the continuum of water safety. He's going to the Navy. So, cheers for that. Okay, here's another project that this is a heartbreak here. So the program at Crawford High School, it's a swim and water safety program where the kids actually enroll in the elective phys ed class that is swim lessons and water safety. And this is really in memory of one of their fellow students who drowned in a rip current the day after he graduated several years ago. So these are some of the kids, and we're super proud of the program. These are kids who barely could put their face in the water on the first session, and they're training to be able to become junior lifeguards at the end of their program. So this is just a program to be proud of. So here's another one of our 2025 action steps, Rip Current Safety. And this is this year's version of the Rip Current bandana. We had a red bandana 2 years ago, 3 years ago, I guess, with the USLA and NOAA Rip Current information on it. And this year we decided to go like more simplified, and we're using the Great Lakes Surf Rescue Project um, uh, talking points. They say flip, float, and follow. So, in terms of collaborating, we can collaborate across the country with other organizations who will gladly share their message with us. Of course, we asked them; their logo's right there on the bottom of the Rip Current bandana this year. But we think that the message is so much easier, especially for the younger kids to understand. So, we think that's a good one. We should get a prize for the best swag. Just saying. Speaking of best messaging, thanks to Sandy. So this is our water safety card this year, and in the past we've said, oh well, we want to do English and Spanish. So if you flip this card over, on the back is complete Spanish of this same message, and we tried to make it easy enough to digest, not too busy. And even if the public just looks at the bottom left-hand corner in the red, if a child is missing, check the water first. That might be able to save a life. So we think that we did a really great job with the messaging this year with the water safety card, and the van has the message on it as well. It's truly the water safety mobile. So if you're following along, you'll get information about Rip Current Safety from the back of the van. Isn't that cool? Somebody put some claps out there. So another action that we're working on this month actually is a project called the Book Pool. It's a water safety literacy outreach. We have a generous donation from the CEK Foundation, and to buy books, to put together 100, thanks Sandy, to put together 100 binders with water safety books. And the three books that I have on the right-hand side are 2024 or 2025 brand new books. So we have the classic Josh the Otter in there and the classic Starfish Make a Wish book, but we also have three brand new books that are going to get out to San Diego libraries. And personally, I don't think the libraries would have found those books but for us giving them to them. So we're just really excited about this. So more clapping. That's a good one. So you asked the question, well, what does it really look like in this space, the work that we do? And although those were initiatives that we just talked through, they have like moving parts, and a project plan kind of thing. But we do one-day events, and we are all about, let's do a proclamation every year for drowning prevention and water safety month. And this year we got to go visit the city council chambers, and it was really, I thought it was a really important day, especially for the young lifeguards and the people in the audience. Each one of the city council members made some remarks just for a moment about how important drowning prevention and water safety was to them personally and to their constituents. And I would encourage anybody listening to do a proclamation every year with your elected officials, and get in there, and because it becomes a topic of conversation that will ripple outward. So that's what some of the work looks like. We gather together and go collect a proclamation. We're also invited, the Prevent Drowning Foundation is invited to the grand opening or reopening of pools or different events. This is another proclamation kind of day. This was Wear Your Life Jacket to Work Day, which you'll see next. And the city of the area of Spring Valley actually turned the tables, and they gave us a proclamation, said that it was Prevent Drowning Foundation of San Diego Day. So they turned the tables on us. That was just a great event to be invited to. Speaking of Wear Your Life Jacket at Work Day, we've been doing this for years, and it's always fun, and I encourage everybody to just do this. It's just one day. The Safe Boating Campaign already has all of the talking points for you. Send out the press release. You'll get some kind of press, have a little, hour-long event kind of thing, talking about the importance of water safety because it is May, and also about boating safety if that applies to your area. We got the news crew actually put their life jackets on today to wear their life jackets at work. So I thought that was a really fun moment. We also have been supporters of Assembly Bill 1005, which is an initiative from Assemblywoman Laurie Davis to encourage schools to connect with nonprofit drowning prevention organizations to provide information to the students and to the parents of the schools. So this was a recent press conference, which was beautifully done and just really heartfelt with some families who talked about their loss, and the physicians and first responders as well, talking about their impact. So another great event, and thank you for additional collaboration. Thanks. Where's Adam? I hope he's on there somewhere, for connecting the Step Into Swim program with San Diego. It was such a beautiful event, a great press conference. It's always great having Rowdy Gaines in town. He is a wonderful speaker, leader, and the kids just have so much fun talking to this legendary Olympian. It was beautiful, and the check was giant. That did go to San Diego organizations that are going to provide free swim lessons across the board. It was beautiful, but it's all because of collaboration, not just within our area, but nationally recognized organizations. We're going from national up to World Drowning Prevention Day. And usually when I say World Drowning Prevention Day, I go World Drowning Prevention Day. And so we send out a press release letting the media know that it is World Drowning Prevention Day. And it's another reason to talk about water safety in the middle of the summer. And our dear friend Asante has been a speaker for us for several years in a row. And if you're not dialed into World Drowning Prevention Day, just their message, just post it somewhere so that you can think about this and share the message that anyone can drown, no one should. It's just a good message that we really should all adopt. This year at World Drowning Prevention Day, Asante ran a program called Float and Flow in one of our warm 90-degree pools. We have a sound bowl healer and a vocalist who chants, and everybody, the lights are lowered. People float in life jackets, neck doodles, pool noodles, or no flotation added, and just float for about an hour in a peaceful, calm, just beautiful place. It's really wonderful, and that's how we celebrate World Drowning Prevention Day this year. It was awesome. We're invited to a lot of community events, and we actually have adopted Josh the baby otter, the water safety mascot, and he's got lots of friends. Everybody wants Josh to visit them, and again, thanks to the CEK Foundation, we have a new Josh. This Josh looks like the Velveteen Rabbit kind of Josh, well loved. So we'll be getting the new Josh out and about very soon. So that's what work in our space looks like: initiatives and events. And so here's just a bunch all lumped together so you can see like just more fun photos. We have a program called Bridge to the Beach. We do splash ball. We had Miss California, Team California, as one of our volunteers. She's a lifeguard in Oceanside, California. So it was just awesome. We have parent and taught events almost every weekend for the past couple weeks. We have this great junior lifeguard program, great adult swim lessons, including pop-up adult swim lessons where people just show up. You may not know about portable pools, but San Diego has had a portable pool for like decades. Again, Schools to Pools and the Bridge to the Beach program are so great. It's with as much water as San Diego has, it's always amazing when we hear of a kid who says, I don't know how to swim, and no, I've never been to the beach. So these are some programs that help with that. Talked about swim lessons. Okay, so here's a hard question, Tina. This is a good one. Thanks very much. Great homework. And it certainly makes all of us think. And so what has been the stumbling block? And well, we're sort of a bunch of volunteers. We have limited funding, limited resources. It would be great to have a government lead. I can't even think about what other stumbling blocks and hurdles that we actually have. But as you can see, we just keep on moving ahead, and we either jump over the hurdles or go around them. So this is another question to ponder. So thank you for helping us face that. So what are our next steps? Thanks to the action step little snake looking grid, um, prioritize, plan better, launch and implement, and with our collaborators, and measure, communicate. And it looks like we already celebrate our progress, doesn't it? So, but measure and communicate, and really celebrate more widely, I think. So, another question that, to ponder is what surprised you about the process? And I think that you're talking about the process of the the National Water Safety Action Plan and those steps. And because we've been around for so long and have had so much action and initiatives, I just wanted to put out there that the thing that surprises me always, not necessarily about the process, is that when we ask for help with our initiatives or events, the answer is yes. And sometimes it's surprising. Like, we say, can we have a proclamation from the city council? And like in 10 minutes, they're like, yes, of course. We're like, oh, wow, that was a little too easy. So, but people say, yes, we'll be there. Yes, you can use our materials. And yes, we'll get you brochures in multiple languages. And yes, I'll come to your pool and teach your granddaughter how to swim. And yes, here's a check for $10,000 so that you can continue your work. So big thanks to all of the donors, Kiwanis, La Jolla Swimmers, all of our donors. Yes, we'll help you with data, and we have get like the smartest people in California helping us to gather data. And yes, you can use our pool, thanks to Tammy Anderson if she's on the line. So that was it makes it like really easy to jump into all these initiatives when you have so many people that are willing to help. And so, in terms of what advice I would give, along with, well, don't forget to ask for help, but also connect, not only in your own community, but connect nationally. You're here on this call, so you're connected with the U.S. National Water Safety Action Plan. Connect in your state, connect with the National Drowning Prevention Alliance and the Association of Aquatic Professionals, connect with Diversity in Aquatics, the World Conference on Drowning Prevention, and get dialed in. So I'm going to wrap it up with big thank you. Encourage everybody, think big, think the world, think globally, and connect not just in your state and local area, but nationally. And then all your action is probably going to be locally, but share it to those in your state and across the country who can learn from what you've done and connect with those that you know. So with that, okay, 10:30 on the dot.
Good job.
Thank you.
Perfect.
Thanks very much.
Thanks, Marianne.
Oh, I see some love. Thank you. So I know that was a lot, but we're doing a lot of really good things here. Maybe it's given folks on the call ideas. We have some work to do in our own board and with our collaborators in using the spreadsheet and really the thought process of the U.S. National Water Safety Action Plan. And then maybe we could get on the action board on the website with some of our actions.
Yeah, no, that would be great. If you want to stop share, and that way you'll be able to see everyone again.
Yeah.
There
And
we
again, thanks,
go.
Tina. Thank you for giving us this homework. It was good to go through this process. I really appreciate you. Thank you for thinking of us.
No, we're so glad to have you and for you to be able to share the work that you've been doing. It's been great to kind of watch the progression of the work that's been done in San Diego over the last, for me, like 15 years or so that I've been keeping tabs on it all. So it's been really phenomenal watching it grow. One of the questions that I have, and certainly we'll open it up to the floor as well. So you were showing the data, right, and mentioning like the number of drowning deaths in bathtubs, and as that kind of stood out to me, and certainly stands out across the country as well. Are there initiatives that you've implemented or that are spurred based on that data? You know, are there educational components in the work that you do that target kind of those data points that you're seeing at this point in time, or is that kind of a future focus?
I'm going to have to go back and look at our water safety card and to see if we really have mentioned bathtubs on there. You saw the beautiful water safety card that we're using, and let's see. We say block access, constant supervision, and then not necessarily mention the word bathtubs. So,
Gotcha.
yeah, no, not specifically. So, but it's not all kids that are drowning
Right.
and dying from drownings in bathtubs. Surprisingly, it's a lot of the older ages. So, thank you for that. Okay, if Sandy's still on the line, there's our homework. But
Um,
that's a great point. Thank you for seeing it from that perspective.
Oh, of course. One other question, and this comes from conversations with other, in particular, states that we've spoken with recently. Um, the data that you are able to capture, you know, from your emergency departments and so on and so forth, is the data from your open water included in that? We've seen, as an example, in New York, sometimes there's an issue between Coast Guard data and and hospital data,
Mhm.
and or crossover. So you might have duplicate entries. Do you find that in your area as well?
So we have what you saw when I showed the data was an 8-year look at California's, strictly from the California Department of Public Health. So we use the 8 years because smaller section, you don't get enough credible data each year in a county as big as San Diego. So we combined it, but we use specifically the California Department of Public Health information. If you compare that to what the Coast Guard says or what the medical examiner of San Diego says, those are different numbers because the California Department of Public Health, and I have it on the top of the data element, it's San Diego residents. It is not the people who drowned or in San Diego. It is the residents who drown in residents of San Diego who drown anywhere. Could have been Hawaii, New York. So we're focusing on residents, but we do know that the medical examiner sees a different set of information altogether. The medical examiner's information is also going to include people who died from drowning due to migrations, with the panga boats coming into, and panga boats dumping out the people who are lost at sea, basically, or rescued or recovered on the beach. So those are not in our resident directions. We have thought about, and I'll throw this out there because maybe will make it happen in the world, is trying to get information to into the airport, that somebody could just pick up a little brochure about water safety, maybe the beautiful water safety card that we already have, just to take with them as they come from the middle of the country, let's say for vacation in San Diego. So the numbers that the medical examiner have would be just the fatalities of anybody that drowned in San Diego, different from the residents' information that I have. Are some of the hospitals, we gather information, the Safe Kids Coalition gathers information just from Rady Children's Hospital. And those numbers are very different. And they could be kids who were admitted who drowned in Mexico, which is only 40 miles, not even 40 miles away, or children who drown in the area, but from anywhere across the country. So yeah, the data, you can't compare it to each other, but we're not taking all the data and digging through it ourselves. We're just using the big picture kind of thing. I think it points us in some direction.
Right.
So, but we can certainly do more. And so thank you for bringing that up. That's a great point too.
No, and it's interesting too, San Diego obviously is a huge tourism spot, much like, when we're talking to folks in Florida, we're talking to folks in
Mhm.
Hawaii and even New Jersey, right? They're
Mhm.
kind of in that same space where tourism on the coastlines certainly
Mhm.
has the potential to impact their data. And so it's maybe not a choice, but how do you focus in on, are you focusing on residents? Are you focusing on visitors? Do you focus
Years.
on both? How do you make a decision on the work that you do based on kind of that tourism industry
Yeah.
in your area?
We're going to have to drive the van around all day in every
Multiple vans, right? Now you need a
multiple.
car
We need
sponsor.
a fleet. We need a fleet of
Yeah.
vans. We actually have Falk Ambulance actually put drowning prevention information on one of their ambulances. So they wrap their ambulance with drowning prevention information. So does that help? We don't have any billboards per se, but although I think the Safe Boating campaign had a life jacket billboard at some point. So we have lots of work to do. We're doing lots of work, but people are still drowning. About 40 drowning deaths of residents every year. Mostly adults, mostly men, mostly in open water. Thanks,
So
Tina.
yeah, so I'll open it up to the floor. I see most people are off camera, but if there are any specific questions that anyone has, um, please feel free.
Good morning, Mary. I'll start, or
Hey,
Megan. Megan, you should start. Megan, you're gonna have a much stronger question.
Maggie.
Go
Oh,
first.
no, I don't even have a question. I was just going to say that Marianne and the coalition in San Diego has really set the stage for how we look at these regional coalitions. The work we've done in California absolutely, on the state level could not have happened without the strength of what was happening in San Diego. And it's been a really good benchmark for the rest of the country to look at what's happening. And so I just wanted to acknowledge that, Mayor, and thank you
Oh,
for taking the
thank
time to
you.
put that together today.
Thank you. You were in the first slide there. Thank you for your leadership.
Gwen?
And Mary, right? Great job, great presentation, great work. Right, and Merrick and I are on something that's kind of the opposite direction. So my question has to go with: have you seen any of the work and efforts that you've put forth in your action plans and so forth, then take where it's influenced so that a lawmaker in the state has taken up that baton and taken one of those suggestions or whatever and start to maybe modify to change regulations?
That's well, let's go back in time a little bit to 2017. And if Julie or anybody from California is on, so not necessarily our actions, but we helped a lot with Senate Bill 442, which was passed in October of 2017. And that bill is legislation requiring pool owners to put a second layer of protection between the house and the water. And it's thanks to one of San Diego's families, Carol Norman and her husband. They lost their son, Nicholas Norman, and they were great influencers as part of that work with that Senate bill. And one of the most interesting things that really helped get the bill passed was having families tell their stories. And you've probably seen the NDPA banners with the kids on the front and the families on the back. And as Steve Barrows was able to get, he called it an art exhibit of the banners were hung outside the governor's office in Sacramento in the Capitol only for like 24 or 48 hours. And it was the banners with the kids' pictures. And then the team went and provided to all of the legislators, whoever's going to vote on this, the cards from Families United to Prevent Drowning, specifically the kids in California that could really have been impacted by having two barriers: kids who drown in the nanny's backyard or the neighbor's backyard. Anyhow, so was it our influence? Maybe not. I think it maybe started, and then we were able to help with resources and people that we knew, including our mayor, Todd Gloria, who he wasn't the mayor at that time, but we needed help with something in the legislation. I didn't even know what the word was. We needed a floor jockey. I had no idea what that was, but because of connections, we were able to pick up the phone and call. I think he was an assembly person at the time, called him, and he was able to be the floor jockey. Like in an hour, he said, "I'll do it, no problem." I'm like, I don't even know what happened. But nonetheless, that your influence is so powerful in legislation, but you know, we weren't the leaders. We were just part of the team. So thank you for that question, Gwen, and good luck. I grew up in Pennsylvania and lived in New Jersey, so I totally get the East Coast swimming things. Yeah.
Austin, I see you have your hand raised.
Yeah. Mary, thanks for the presentation. I know
Hi, Austin. So nice to see you. Big
good to see you
hug.
again. Yeah, what's it been since February, I think?
Mhm.
Yeah, I know that we're still in the process of kind of reviewing all the action points and getting it out there. And I know especially in at least in our neck of the woods, budgets and stuff for drowning prevention and water safety are kind of being slashed, at least on kind of a federal level. I was wondering if you had any, like, I loved what you were saying about getting the ambulances wrapped and just asking people, are there, I guess, certain ways that you ask that tend to yield better results? Is it presenting evidence? Is it just saying, here's kind of our mission, here's what we're doing? I've had some luck with that because it's hard for people to be against kids and adults drowning. It's a pretty solid pitch. But just wondering, like, if you had any insight into what are some of the more beneficial ways, or I guess successful ways that you've been able to gather partnerships like that.
Well, so get tight with your collaborators and your partners. Honestly, have lunch, have cake, something, have a party, have a water safety party at your office, at your house. Most of us are volunteers, but the people that do the work in our world are people who work for like the park and recreation. But there are pool owners who would be glad to step up to like offer things that you don't even know that you need. Oh, here's 100 books to go in your binder. I did mention that I was surprised at the asks, and we don't ask for money enough. We do ask for help though. Can you show up? And I guess we're better at that than asking for actual funding. Although people do tell us, oh, here's a grant, you have to fill this out, kind of thing, or fill out this form, kind of thing. But Austin, thank you for your question. How does it work? It's staying close with the people that you know, or even asking, do you know anybody that could help us? Or we're thinking about doing this event. Who should I invite? And if you leave it open, then maybe people will, they'll have a great idea that you might not have thought of. I will encourage you, just ask, and yeah, get ready with the data and all of that. But I'll tell you a 1-second story. About 10 years ago, we did a program. Well, it's a little more than that ago. There were some drownings with young teenage boys across the country, multiple drownings. And we're like, we need these kids to start wearing life jackets. How are we going to who are we going to get? And so we immediately think, Colin Jones, he just won a gold medal. And I came home and I'm like, I love Colin Jones, no offense. My kids are like, who's Colin Jones? I'm like, oh, for God's sakes. So in San Diego, we have the Navy SEALs. And they're not going to listen to Mary, but they're going to listen to the Navy SEALs. So I had done a project with one of the captains of the Navy SEALs. So I called up Captain Bob of the Navy SEALs. I know that sounds psycho. And I said, we have this idea. There's all these drownings. The target group is young teenage boys. And I took this binder full of like flip notes and stats and all of this kind of stuff. He said, Mary, we're in. What do you want us to do? And it was just a simple thing. We just wanted him to show up one time with a Navy SEAL and put some life jackets on the kids and talk about the importance of swim with a buddy, have a plan, always have flotation, and also learn to swim the combat side stroke. But I sound like a crazy person say, well, I called up Captain Bob of the Navy SEALs. So I don't know. We're all just people and we all care about people drowning, and almost everybody has a story. So collect those stories and stay connected and ask. Go ahead, ask.
Awesome. Thank you, Mary. I appreciate it.
Oh yeah, you're gonna give me a full report next February.
That's right. Colorado Springs, right?
That's right. Yeah. Thank you.
Any other questions for Mary? So while folks are thinking, just going back to that kind of conversation around funding, one of the things that keeps coming up in these discussions as we talk about developing strategies or developing written plans, if you will, is that funding question, right? It's going to cost me money. Where do I get the funding to make this happen? And repeatedly, the agencies or coalitions that have put out their plans have said, we've leaned on our partners. We've leaned on VIK, right? We've leaned on the partner who maybe has an editor, who maybe has a printing press, who has, right? Like, and so while yes, there is a need for some funding, that we want to make sure that folks also understand there are ways of creating these strategies and putting these strategies together that don't need a ton of money behind them in order to get at least the documents across the finish line. Certainly you'll need the partners and their support in that process, but it can be done. And so I just want to caution people from hesitating to step into the space because they're worried about money. There are ways of getting around it and ways of finding the support that you need to get things to happen. So just putting that out there based on conversations we've had in the past.
I have a question.
Yeah.
I raised this to Mary Downing, a great presentation, so much energy. I thank you so much for the information. One of the challenges we've seen in Fresno County, maybe the same in San Diego County or in any of the other counties of people here, is that we've done lots of these things where we've gone to the communities, we've shared our messaging. How do you measure your successes? How do you measure that? And I mean, we want to look at the drowning numbers. We can say that Fresno County has increased in population since we started in the early 1980s. But I don't know. I don't have any specific measures or events or tactics that we've done that have shown that this is what's working to save lives. Does anyone have a happy story or a way in which they're showing this is what we're doing and this is how it's affected our population to reduce drownings? Does anyone? Mary?
Oh, so I've been in San Diego since 2006, and the next step I think that we need to do is go and pull all those numbers year by year. The problem is the numbers are so low that, you know, when you try to pull them, it's not like credible by age group. But we could tell how many drowning fatalities we've had of residents year over year. But that doesn't tell us the whole story. No, absolutely not. I don't know, Mark. I know that Fresno is very different than San Diego because you're inland. You have inland waterways that I think that was one of your hot spots, lack of life jackets and drownings in canals and such. I don't know that we do a good job we've collected the data and we can show the data so that we get the awareness out there. But do we have a happy story at this point? Well, it looks like three kids die from drowning. 3 1 to 4-year-old residents of San Diego are expected to die from drowning every year, and hundreds go to the hospital. The good thing is they're going to the hospital and being released, but we haven't done a wide scale review. Maybe that's where our friends, Dr. Orion Stewart, maybe he's already working on it for every county through the California Department of Public Health.
I wish I could say Orion was doing it. I think he's moved on to other
Uh-oh.
things. The same thing
Renee?
with Renee. They
Uh-oh.
both moved away.
I'm out of the
if I'm not-
loop. Oh, darn. Is Johnny still there? Okay, we'll have to connect to see who's working on.
Lisa, I see you have your hand raised.
Hi, I just great presentation. I wanted to say on behalf of like the drowning, I know it's a hard thing to do, but like making it positive, like not just educating us on the drowning, but like because I'm from Ramona and San Diego, everything we do is related to water, right? So I mean, just not necessarily going into like negatives on the drowning, you know, but like just focusing more on the water safety. Like I know I got into the emergency medical responder and the water safety planning together through the Red Cross because it offers the most information out there, like to just get out there into your community and to get out with you guys and to learn the information. But I think that's it, just keep doing what you're doing. It's working, you know, it's working on a community level and on a school level, and yeah, it's working, you know.
Thank you. And our partners, Lisa, are the Y does the Y lifeguard and the Y lessons, but the San Diego Parks and Rec, they're a Red Cross providers. So all the kids are getting lessons, and we are actually using the American Red Cross water competency sequence when we for our grantees. We ask them to ask the question at the beginning and then track at the end of the lessons how much they've improved in terms of using the water competency sequence. So we should have some data eventually. But thank you. And let's get together. Ramona's not that far.
Austin, your hand's back up.
Yeah, I was just gonna respond to Dr. Simonian's question. I think I'm fortunate that I work for Columbus Public Health in Ohio, and so we actually have an in-house epidemiology department that has been able to help pull in numbers from like Columbus Fire and whenever they go out on water rescues and things. Tina, are you okay if I share my screen really quick?
Sure.
Okay. This is just kind of the data visualizations that they put together for us. But it's broken down by year down here and then different zip codes. So this is kind of where we are able to target a lot of our outreach materials. Obviously the 2020s early were not good years, but once we took over the Pool Safely grant in 2022, we saw that a lot of stuff started to kind of drop off. It's a lot of messaging, but they're also able to put together different heat maps so you can see what parts of the city are getting together, you know, where the drownings are happening. They're even able to kind of give more in-depth detail, and a lot of these places tend to line up with what are in Columbus known as like aquatic deserts. Just no public swimming pools. There's not a lot of you know, education that can happen there, and so a lot of people are going to retention ponds, things like that. So, but this was the kind of crazy data that when we pulled it to apply for the grant the next year, last time we pulled it was, you know, here when numbers were spiking in May, we had 17 drownings alone in 2020. And so seeing a couple years of outreach and what are we doing in 2023, numbers were really starting to drop. And then 2024, there was only one up to that point that we had pulled the data. So, and then they also give like the main names of places that water might be responding to. So it's not perfect because we're only capturing Columbus's data. So when there are different townships or something that are responding, we're not necessarily pulling that data, but I think Columbus data is robust enough that we're at least getting a good picture, and then we can make certain inferences from where we need to concentrate resources outside of that. But I'll stop sharing. Sorry, I just wanted to show kind
Wow.
of a visualization on how we're deciding to tackle and prioritize certain parts of the action plan. So thank you.
That was amazing.
Yeah, thank you. And for sure, I think there will be areas that you're not going to be able to make a direct correlation, right? The work that you do versus a reduction in drowning rate, but you'll know that you're making a difference, right? And this is the space that we work in. Not everything is a direct action reaction, unfortunately. But we know from an educational standpoint, if we start to see numbers dip because of some of the, education or marketing purpose things that are put out, then certainly you can make that connection backwards. But it takes time, and that's part of the reason why even the U.S. strategy, it's a 10-year plan. We need to be able to implement the things that we've got in the plan and then see over time what that looks like. So like Mary, when you showed your data over that time span, right, then you're able to get a much broader perspective on things than just reacting to this past year or this current year. So it's really, really helpful. But data is key. And I will say that for anyone who needs some support in figuring out where to go to find data, we've got a couple of really short 20-minute webinar sessions on the website that you can go and click into. Florida, California, I think New Jersey, New York. We've got some webinars on there that feel free to click through those. They're free and readily available on the site for you to listen into, and that might be helpful. The other thing that I want to share before we close out here really quickly, we were talking about this just prior to getting started. On the National Action Hub website, currently we have a report actions page. I'm going to throw that into the chat here really quickly. One of the things that we're doing with this is we're creating a map. So if you have initiatives, strategies, coalitions that are working on strategies in place in your communities, in your states, we'd love for you to fill out that form on that page. The map will be able to showcase that information visually. So folks will go to the page, they'll see, for example, California has a strategy that's launched. You'll be able to click on California and see the strategy link, the social media links, when the plan was launched, any contact information that might be relevant. So we're putting that together now. So if there is specific data and information that you would like shared publicly, then please go in and fill out that form on that page. Be really, really helpful for the wider community of drowning prevention and water safety. With that, any other questions?
Tina, I'm looking at it and it says like initiatives / planning focus. We're still in the early stages of, I guess, trying to hone in on that specifically. If I were to fill this out, is there, I guess, how do you think I should categorize something like that?
Yeah, so I will say, and as we start to populate it, right now I've got 3 different tiers set up. One is emerging, the second is in development, and then the third is published. So if you're just in the early phases, then just let us know that. I mean, you can simply say, we've had a couple of meetings, or, we're starting to connect with folks. Then I'll put that into a category. But really it's more about, is there contact information that we can share publicly? Are there website links that we can direct people to? Is there contact information that we can share with folks if they want to reach out? I think one of the things, and Mary talked about this too, is it's about developing the relationships, right? And if we can help people network and find answers or to collaborate on some things, then that's really the goal for the map, is to be able to connect folks so that they can find the support that they need to get the work done. Great. All right. Well, if there are no other questions, Mary, thank you again. And thank you to your team
you.
for participating and for sharing this information today. A wealth of information, great resources. And we really, really appreciate all of the work that you're doing in San Diego and your time.
Thank you so much. Thanks, everybody.
Thank you, everybody, for coming. And we will get this posted out on the website so that you can share it with your colleagues as well.
Thank you. Good job, Mary.
Oh, thanks, everybody. Bye now.
Have a great day.